Hi, welcome to my YouTube channel, Dental Mastery Hub. Today we are going to discuss embryology, my endodontic topic. So let's start. Embryology. The pulp and the dentin are different components of tooth that remains closely integrated both functionally and anatomically throughout the life of the tooth. The two tissues are referred to as the pulp dentin organ or the pulp dentin complex. Here we'll study about development of the dental lamina and dental pulp. Dental pulp has its genesis at about 6th week of the intrauterine life during the initiation of tooth development. It is oral stratified squamous epithelium covers the primordia of the future maxillary and mandibular processes in a horseshoe-shaped pattern. Formation of dental lamina. Tooth development starts when stratified squamous epithelium begins to thicken and forms the dental lamina. The cuboidal basal layer of the dental lamina begins to multiply and thicken in 5 specific areas in each quadrant of jaw to mark the position of the future primary teeth. Formation of ectomesenchyme. The stratified squamous epithelium covers an embryonic connective tissue that is called ectomesenchyme because of its derivation from the neural crest cells. By a complex interaction with the epithelium, this ectomesenchyme initiates and controls the development of the dental structure. The ectomesenchyme below the thickened epithelial areas proliferates and begins to form a capillary network to support further nutrient activity of the ectomesenchyme epithelium complex. This condensed area of ectomesenchyme forms the future dental papilla and subsequently the pulp. Then the tooth development has 4 stages. Birth stage, where it is the formation of enamel organ, cap stage, outer and enamel epithelium. Then we'll study about the formation of the dental papilla, formation of the dental follicle, dental sac, bell stage, cervical loop. So let's start. Let's continue from the bell stage, birth stage. Here we are going to see the birth stage, formation of the enamel organ. Birth stage, thickened epithelial areas continue to proliferate and to migrate into ectomesenchyme. In the process it form a bud enlargement called the enamel organ, hence bud stage of the tooth development. Then cap stage, outer and inner enamel epithelium. Enamel organ continues to proliferate into ectomesenchyme with an uneven rhythmic cell division, producing a convex and concave surface. Characteristics of the cap stage of the tooth development. Convex surface consists of cuboidal epithelial cells called as outer enamel epithelium. Concave surface called inner enamel epithelium consists of elongated epithelial cells with a polarized nuclei that later differentiate into ameloblast. A distinct basement membrane separates the outer and inner enamel epithelium from the ectomesenchyme. In the region of the inner enamel epithelium, a cell-free or acellular zone also separates the enamel organ from the ectomesenchyme. This acellular zone contains the extracellular matrix where the future pedentine will be deposited. Between the inner and outer enamel epithelium, the cells begin to separate due to the deposition of intracellular mucoid fluid rich in glycogen that forms a branch reticular arrangement called stellate reticulum. Then formation of the dental papilla. The ectomesenchyme, which is partially enclosed by the inner enamel epithelium, continues to increase its cellular density. The cells are large and round or polyhedral with a pale cytoplasm and large nuclei. This structure is the dental papilla which differentiate into dental pulp. Formation of dental follicle or dental sac. When the ectomesenchyme surrounding the dental papilla and the enamel organ condenses and becomes more fibrous, it is called the dental follicle or the dental sac. The precursor of the cementum, periodontal ligament, PDL, and alveolar bone. The dental lamina continues to proliferate at the point where it joins the deciduous enamel organ and thereby produces the permanent bud lingual to the primary tooth germ. Cell stage cervical lobe. The cells of inner enamel epithelium continues to divide and thus increase the size of the tooth jaw. During this growth, the inner enamel epithelium invaginates deeper into the enamel organ and the junction of the outer enamel epithelium and inner enamel epithelium at the rim of the enamel organ becomes a distinct zone called the cervical lobe. The deep invagination of the inner enamel epithelium and the growth of the cervical lobe, partially enclosing the dental papilla, begins to give the crown its form, called as a bell stage development. Then during this stage, the dental minor that migrated into ectomesenchyme degenerates. The primary and permanent buds are thus separated from the oral epithelium, and the distal portion of the dental lamina proliferates to form the buds of the permanent molars, which have no primary preceders. As the development progresses, several layers of the squamous cells between the stellate reticulum and the enamel epithelium forms the stratum intermedium. This layer of the cells is limited to the area of enamel inner enamel epithelium and seems to be involved in enamel formation. Node stratum intermedium is enamel, ectomesenchyme is dentine, and dental papilla that forms the pulp, and dental follicle or dental sac that forms the cementum, the medial alveolar bone. Thank you for watching. Please do not forget to subscribe my YouTube channel, Dental Mastery Hub. Dr. Gayatri. Thank you.